Let's get an update on the coronavirus figures in the UK now. We understand that there are 319 positive cases in the UK, 24,641 negative tests. So 319 people have tested positive in the UK. That's up from 273 at this time yesterday. Let's bring in our correspondent, Ashish Joshi, who is here with me. Ashish, a jump of 46.
A rise of 46, and what the clinicians and the scientists will be looking at is when they're doing their modelling, when they're looking at the figures rising, they'll see that there's been a bigger rise prior to this. So I think over the weekend there was a rise of 67 and then 46. They'll be able to make sense of the numbers and what that actually means. We know about the cases, the two in Wales today. I think there's one in on the Channel Islands. And the other key figure here are the 3 patients who've tested positive for coronavirus who have died. So no more fatalities. This is the number that's issued by the Department of Health at 2 o'clock every afternoon. So we can see a rise there of 46 more positive cases. So the numbers themselves look like, you know, it's difficult to say at the moment, but they do look like they're stabilising. What we were expecting over the last few weeks, when you listened to the experts who had been watching developments in Italy and China and South Korea, those figures doubling day by day, but certainly the contingency plans put into place by the government seem to be holding.
Yeah, and as you say, looking for patterns and looking for that trajectory rise. This isn't the highest daily rise that we've seen, but still up to 319. But that key figure, 3 patients have sadly died.
Yeah, 3 patients have died. The ones who all, and this, we need to stress this, who were all in that age group who are most at risk and who all had underlying health concerns. The Department of Health, the government, the Chief Medical Officer, they are at pains to tell us that this is a very serious virus. It will affect lots of people because of its transmissibility, high infection rates, but the people who are most at risk are those with underlying health concerns who are in the higher age groups, 60, 70, 80 plus. For the rest of the population, not so serious, but of course the danger is that you're spreading the virus on to people who are, or parts of the community who are more susceptible to the virus. But certainly the figure today that